Dr. Lamb, we're doing a Peabody and a reverse Peabody. What that is we're dealing with a bunion on the big toe as well as the bunion on the little toe. So the foot goes out like this. This patient from North Carolina traveled all this way for the Peabody and reverse Peabody, minimally invasive surgery. Just numbed her up right now, so we're going to go in there, say hi, take a look, and go from there. Well, this is the pre-op. This is pre-op. She's already been prepped, surgically draped. We're dealing with a bunion right here and a Taylor's bunion right here. It's more appreciable on the x-ray than it is in live person, but when we get ready to get scrubbed and we'll take an x-ray during surgery. You see that little bump right here on that? That's called a Taylor's bunion right here. That's a regular bunion. Let's get this taken care of. This is post-Peabody right here, right after surgery. You can see her fit toes corrected right here. Her big bunion is gone on this side. The stitch is right underneath here. Let me get the gauze here. Stitch is right there, the one stitch. The bunion is gone. It's overcorrected over here a little bit on purpose because later when I think the pinout is going to come in and she'll still remain with a nice border right here. This is nice and flat. So her foot is nice and flat compared to before the surgery, as you can see. But once the pin comes out, the toe is going to come on back over. She has no pain right now. Are we good? Very good. So I'm going to go ahead and get some PRP in her to increase the healing rate of the osteotomy site. I'm going to wrap her up, but this is swelling. This is immediately post-op. This is 22 minutes later. Same patient pre-op right here. See the bunion right here she came in for? And then there's a Taylor's bunion on this side that you saw. I mean, it's worse on X-ray than it is in real person. So she thought she had a little bump, and yes, she does. So we went ahead and fixed that. Now, 22 minutes later on the tourniquet time, we went ahead and fixed the bunion via the Peabody bunionectomy. Again, that incision was really small, so that way I don't have to make a big incision. All the soft tissue is intact over here. So all the tissue that normally we would cut during surgery, I didn't have to because the instrument just went in and made a precision cut straight through. Precision cut straight through, the wire came through, the wire came through. The wire just there act as a buttress, so this bunion doesn't go back again. But you see that touching it? It's right on the edge because you had a severe bunion. So it's right on the edge right now. That is going to heal up. That bone is going to be modeled. That's going to be a perfect looking bone. You see that bump right here? I didn't take it off, right? I just moved everything over. I just moved that whole thing over. So you can see this is as close as it's going to get to the second metatarsal. And the toes, like I said, overcorrected a little bit as you saw before. But once I take the pin out, it's going to come and sit comfortably right next to the second toe perfectly. So that angle is perfect. That right here touching, that's going to be perfect. The bone is going to heal up. And again, same right here. The incision again is really small, one stitch. And I'm using a durable stitch on it, so I don't have to remove the stitch at all even. So we just go straight to the wire removal when I see you in the office. I know you come from far away, but you can see everything's in place. You see how narrow your foot went. We went from here, I can't even extend my fingers, to right here, in between my fingers now. So that's the result. Within 22 minutes, localize you. You're going to be numb for up to 24 hours, and we'll get you a boot, and then go from there. How's that feel? Okay. Everything wasn't too bad, right?
No.
No, not at all.
No.
So hope the trip from North Carolina is worth it, and you see your results, right? Awesome. You have, this is the finished product. This is the bandaging. My professor always said, patients don't care about what you did inside. The bandaging at the end of the day to show us the skill of the surgeon. So a bandage her in the corrected position. That's how we look at it. Right after the bunionectomy on the way home, we're gonna get her a boot to walk in to protect herself. So it's very stable. Just notice I can move around this foot. She has something called foot drop because I numbed her leg up. So when I do this Peabody bunionectomy or the land bunionectomy, I numb up from the knee down. So she's numb and she can't move her ankle. That'll be for a few hours. She'll be numb for up to 24 hours, where usually people have a lot of pain for 24 hours. Once we get over that hump, we're going to be pretty good. Okay, I gave you some pain medicine, I gave you some antibiotics. So go ahead and don't be a hero, take the pain medicine, okay? At least for the first 3 days until you find out where you normalize that, okay? We're going to get some ice behind the knee, and get some ice on the ankle. That can help you cool it down. We have ice packs here too. So as you can see, the toes are nice and straight, the piggies were looking at me. And again, this is the pre and post right here. And visit us at scarlessbunion.com. And you'll see more pictures, more videos, and subscribe to our YouTube channel. So, any questions for me? So I know you've been to other podiatrists for a consultation before about this, and You were telling me about the scar, the young lady. Sometimes with a traditional bunionectomy, you do end up with a big scar. You can't avoid that. Again, with this, the small incision, we don't do collateral damage. We just do the cut that we need. Everything's in place. So all the tendons, the ligaments that you were born with actually help to hold our bunionectomy in place. That's why I only need one pin to hold everything together, because the soft tissue, the tendons, the ligaments, the nerves, everything on it. That's why there's less chance of tissue damage, less chance of nerve damage, less chance of tendon damage. It's all there. It's going to hold everything in place for you, and that's going to help you to heal.
Very happy.
Awesome. So the experience was good, just as expected. And we're going to get you the boot today. You go enjoy Naples, and I'll see you back in a few days. We'll do a dressing change and send you back to North Carolina. Okay?
Sounds great.
Awesome. We'll see you then.